It's very important that you know about the medicines that you're going to put in your body. And many of you already know this, but sometimes we don't think through all situations. So if a doctor writes you a prescription, you're most likely to question it. You're going to say, okay, what's it for? What are the side effects? And you're going to ask the doctor some questions. Most likely, in most cases, you might even question the pharmacist before picking it up. But let me give you a situation where you might not think logically through something because it happens all so fast. The example is you go to an orthopedic surgeon and you have a shoulder or a knee problem. And the surgeon says, he takes an x-ray and says, hey, I think you got something going on here, but, are you thinking about surgery? We can maybe put this off. How about we do a cortisone injection? And you say, oh, okay. Well, the doctor's suggesting it, and they said it would give me some relief. Well, relief of maybe some pain, right? But what about the side effects? Did you think to ask about side effects? Like, what if you're a diabetic? What is it going to do to your blood sugars? Where cortisone raises your blood sugar. What about the joint moving forward? Does the cortisone affect the joint? Yes. It can weaken the joint. It can weaken the structures around the joint. It can make it more susceptible to injury. What about hunger? Yes, cortisone can increase your hunger. What about sleep? Yes, cortisone injections can affect your sleep. What about your skin at the site of the injection? Yes, cortisone can affect the skin at the site of injection. It can thin it out. It can decrease the coloring, the melanin around that area. What about fat deposition? Yes, a cortisone shot can decrease that fat in that area. You guys, there's a lot of things that we just don't think about because we're in the moment and they suggest something for pain relief and we're not thinking maybe, okay? So it's very important to ask, that's called informed consent. You want to know all of the pros and the cons of that medication because the doctor, he's not really thinking through that. He's thinking, you know what, we'll just buy him some time before surgery. But your thought is you don't want to have surgery in the first place. And then you put that injection in there and then it worsens it over time. It's going to decrease the stability of that joint. It's going to make it weaker. It's going to make it more susceptible to injury. They may or may not tell you that. They're just trying to buy you some time. They get paid either way. They get paid for the injection and they get paid to do surgery later on. Informed consent. Know everything before you have some medicine put in your body. You guys have a great day. See ya.